You need to watch this if you struggle with diabetes. Yeah, this video is about the different types of diabetes, and we're here to help you extract the most important takeaways and maybe even uncover some surprising insights. Ready to get started?
Absolutely. It's amazing how much we think we know about common conditions like diabetes until we start digging deeper.
Yeah, exactly, and the sheer number of people affected is pretty eye-opening.
Oh yeah, the video mentions that over 37 million people in the US have diabetes. Wow.
That's over 10% of the population. And then there's another 84 million with prediabetes. Right.
Many of whom don't even realize it.
That's right. And it highlights why understanding this condition is so important for so many people.
Absolutely.
So let's break down these different types of diabetes and see how they impact the body.
Okay, we know the video focuses on the three main ones: type 1, type 2, and gestational diabetes.
Yeah, they all involve blood sugar. But what's the actual difference?
The key difference lies in how each type affects insulin, a hormone that regulates blood sugar.
Okay.
With type 1 diabetes, your immune system attacks the cells in your pancreas that produce insulin.
So your body is attacking itself.
It's like friendly fire, unfortunately.
So in type 1, the body is waging war on its own insulin factories.
Exactly. And without insulin, your body can't use glucose for energy, leading to many problems. That's why people with type 1 diabetes require lifelong insulin therapy.
Now, how does type 2 diabetes fit into all of this?
Type 2 diabetes is a bit more complex. It usually develops over time and it's characterized by insulin resistance.
This means your body's cells don't respond to insulin as well as they should. Okay?
And your pancreas has to work overtime to produce more insulin to keep up.
Got it.
Eventually, the pancreas can't keep up with the demand and blood sugar levels start to rise.
So it's like your body is ignoring the insulin signals and the pancreas is getting burnt out trying to compensate.
That's a great way to put it. And then we have gestational diabetes.
Okay, which occurs during pregnancy.
Right? The video mentioned hormones playing a role there.
Yes. The hormonal changes during pregnancy can sometimes lead to insulin resistance, just like in type 2 diabetes. Thankfully, gestational diabetes usually resolves after delivery.
But it does increase the risk of developing type 2 diabetes later in life.
Okay, so we've got the different types down. Now let's talk about the symptoms.
Sure, we all know the classic signs of diabetes: increased thirst, frequent urination, fatigue.
Right?
But the video mentions some lesser-known symptoms too. Let's dive into those.
Absolutely. Recognizing those less obvious signs can be crucial for early detection.
For sure, for instance, with type 2 diabetes. Some people experience discolored patches of skin in their armpits and neck. S1. Media group. Person nodding in agreement, patient looking thoughtful at it, stock at it, distribute _ equally. Yeah.
Really?
It's called acanthosis nigricans and it's basically a sign of insulin resistance.
Wow, that's not something I would have ever associated with diabetes. What about type 1? Any unexpected symptoms there?
With type 1, sudden and unexplained weight loss can actually be a red flag. And then there's diabetic ketoacidosis or DKA.
Okay.
A serious condition that can develop when blood sugar is extremely high and there's not enough insulin. Your body starts breaking down fat for energy-producing ketones, which can build up in the blood and become dangerous.
It sounds like DKA is a real medical emergency.
It absolutely is. It's important to know the signs and symptoms and seek medical attention immediately if you suspect DKA.
Okay, so the symptoms can be pretty diverse and sometimes unexpected. Let's shift gears now and talk about risk factors.
Sure. What makes someone more susceptible to developing these different types of diabetes?
When it comes to risk, both genetics and lifestyle play a role. Okay, though the extent varies depending on the type of diabetes we're talking about.
So break it down for us. What do we know about the causes of each type?
Well, with type 1 diabetes,
Yeah.
the exact cause is still somewhat of a mystery, but it's thought to be a combination of genetic predisposition and something in the environment triggering the immune system to attack those insulin-producing cells.
So something triggers it.
It's important to emphasize that lifestyle choices do not cause type 1 diabetes.
So it's not about what you eat or how much you exercise. It's more about a complex interplay of genes and environmental factors.
Exactly. Now, type 2 diabetes has a much stronger link to lifestyle factors. Okay.
Like being inactive, carrying extra weight, and family history.
Right?
But genetics and other factors also play a part. It's not a simple equation.
It sounds like while our genes might deal us a certain hand, making healthy choices can significantly reduce our risk of developing type 2 diabetes, right?
That's a really empowering way to think about it. And with gestational diabetes, yeah, family history of diabetes and having prediabetes before pregnancy are key risk factors.
Okay. So let's talk about those potential complications that can arise if diabetes isn't well managed. The video made it clear that this is a serious condition with long-term implications if it's not addressed.
You're absolutely right. And this is where understanding the potential complications really underscores the importance of managing blood sugar levels effectively.
Right. The video stressed that point repeatedly. What are some of the specific complications that we should be aware of?
One of the biggest concerns is damage to blood vessels, which can lead to cardiovascular disease.
Heart attacks and strokes.
Yeah, I think most people are aware of the heart health risks associated with diabetes. What about some of the less well-known complications?
Diabetes can also wreak havoc on your eyes, specifically leading to a condition called diabetic retinopathy.
Okay, I've heard of retinopathy, but remind me what's actually happening in the eye.
Essentially, high blood sugar levels damage the tiny blood vessels in the retina at the back of your eye.
Okay.
These vessels can swell, leak, or even close off, completely interfering with your vision. So it's like those high blood sugar levels are slowly eroding the delicate structures in your eyes. That's pretty scary.
It is a serious complication, and it can eventually lead to blindness if left untreated.
Wow, it's incredible how interconnected everything is in the body.
Yeah, high blood sugar doesn't just affect your pancreas, right?
It has these ripple effects throughout your system.
It really does. What other complications can arise?
Another major area of concern is nerve damage,
Okay,
also known as diabetic neuropathy.
I have heard of that, but I don't really understand what it means for your body.
Sure, is it just a little tingling?
It can start that way,
Okay,
but it can progress to serious pain, numbness, and even loss of sensation, particularly in your hands and feet.
so you might not even feel a cut or a burn. That's really dangerous.
Exactly. It makes you more susceptible to injuries that you might not even notice.
Right.
And those injuries can then lead to infections and other complications. In severe cases, it can even result in amputations. That's a stark reminder of how serious these complications can be.
For sure. Anything else we should be aware of?
Diabetes can also significantly damage the kidneys,
Okay.
leading to a condition called diabetic nephropathy.
Now, I know the kidneys are responsible for filtering waste products from the blood. How does diabetes interfere with that?
High blood sugar levels damage the tiny blood vessels in the kidneys, making them less efficient at filtering waste. Over time, this can lead to kidney failure.
Wow. So we're seeing how diabetes can impact nearly every major organ system in the body.
Pretty much.
This is giving me a whole new perspective on this condition.
Yeah, it's definitely a systemic disease. And there's one more connection that I find particularly intriguing: the link between type 2 diabetes and Alzheimer's disease.
Oh yeah, that's a really interesting one.
Really, I had no idea there was a connection there. Tell me more.
Research suggests that having type 2 diabetes, especially if blood sugar is poorly managed, right, can increase the risk of developing Alzheimer's disease later in life.
So, on top of all these other complications, we're also talking about a potential impact on brain health.
Yes, it's a complex area of research.
Sure.
But the link between type 2 diabetes and Alzheimer's is becoming increasingly clear.
Wow.
Some researchers even refer to Alzheimer's as type 3 diabetes,
Oh, wow.
because of the shared features of insulin resistance and glucose metabolism problems in the brain.
Okay, I'm definitely going to have to do some more reading about that. It's pretty mind-blowing to think about, and we can't forget about the complications during pregnancy that we discussed earlier.
They're right. High blood sugar during pregnancy can pose risks for both the mother and the baby, including preeclampsia, a dangerous condition characterized by high blood pressure.
And an increased risk of miscarriage, stillbirth, and birth defects.
It's clear that uncontrolled diabetes can have far-reaching consequences.
Absolutely. But let's shift gears now and talk about treatment strategies.
Okay, the video mentioned a variety of approaches for managing and treating diabetes. Where do we even begin?
The treatment approach really depends on the type of diabetes and the individual's needs.
Okay, for type 1 diabetes, lifelong insulin therapy is essential, as we discussed earlier.
Right?
The goal is to replace the insulin the body can't produce on its own.
And I remember the video mentioning different types of insulin and different ways to administer it.
Yeah, can you break that down for us?
Absolutely. There are various types of insulin available, each with different onsets of action and durations of effect.
Got it?
Some are fast-acting, others are slow-acting, and some are in between.
Okay.
They can be administered through injections using a syringe or an insulin pen, or they can be delivered continuously through an insulin pump,
Okay.
which is a small wearable device.
It sounds like there have been some pretty amazing advancements in diabetes management technology.
Oh, absolutely. One of the biggest game changers has been the development of continuous glucose monitors, or CGMs.
I've heard of CGMs, but explain what they are and how they work.
A CGM is a small device that's usually worn on the arm or abdomen. It has a tiny sensor that's inserted just under the skin to measure glucose levels in the fluid surrounding your cells.
Interesting.
The sensor sends readings to a receiver, which can be a separate device or even your smartphone,
Okay.
allowing you to track your blood sugar levels in real time.
So instead of pricking your finger multiple times a day, you can basically see your blood sugar trends right on your phone.
Exactly, it's revolutionized diabetes management,
Wow.
giving people much greater insight into how their blood sugar fluctuates throughout the day and night.
Okay.
This allows them to make more informed decisions about their insulin dosages, meals, and activities.
That sounds incredibly helpful.
It is. So what about treatment for type 2 diabetes?
With type 2 diabetes, the focus is often on managing blood sugar levels through lifestyle modifications and, if necessary, medication.
Right. The good news is that in some cases, type 2 diabetes can actually be reversed through these lifestyle changes.
Okay, so tell me more about these lifestyle modifications, sure. What kind of changes are we talking about?
Adopting a healthy, balanced diet that's low in processed foods and added sugars is crucial.
Okay.
Losing weight, even a small amount,
Yeah.
can make a big difference in improving insulin sensitivity.
Okay.
And regular physical activity is essential.
So it's not about becoming a marathon runner.
Right. It's about finding ways to incorporate more movement into your daily routine.
Exactly. Even taking the stairs instead of the elevator or going for a brisk walk during your lunch break can have a positive impact.
And if those lifestyle changes aren't enough to manage blood sugar levels, right, medication might be needed.
That's right. The first-line medication is usually metformin,
Okay.
which works by reducing glucose production in the liver and improving insulin sensitivity.
And if metformin isn't enough, there are a variety of other medications that can be added to the treatment plan to help control blood sugar levels effectively.
This all feels a bit overwhelming.
Yeah, it can be a lot to take in.
It's great to have so many options, but it's also a lot to take in.
Sure. Is there anything we can do to prevent diabetes in the first place?
Well, we don't yet know how to prevent type 1 diabetes.
Okay.
There are definitely steps you can take to lower your risk of developing type 2 diabetes.
Encouraging to hear. What are some of the key things people can do to lower their risk?
Many of these strategies overlap with the lifestyle modifications we just discussed for managing type 2 diabetes.
So it's about making those healthy choices a part of your everyday life.
Exactly. Not just something you do when you're diagnosed with a condition. It's about taking a proactive approach to your health.
Right.
Managing your weight and focusing on a nutrient-dense diet are essential,
It's not just about restricting calories.
but about making sure you're getting the vitamins, minerals, and fiber your body needs.
So quality over quantity when it comes to food.
Precisely. Regular exercise is also crucial. And again, it doesn't mean you have to train for a marathon. Just incorporating more movement into your day-to-day life can make a big difference.
What about other lifestyle factors? Are there any other things people can do to lower their risk?
Avoiding smoking is absolutely crucial.
Okay.
Smoking damages blood vessels and increases the risk of a whole host of health problems, including type 2 diabetes.
Right.
It's also important to manage high triglycerides, a type of fat found in your blood, and to maintain healthy levels of HDL cholesterol,
Okay.
often referred to as good cholesterol.
It sounds like these are all things that can have a positive impact on overall health.
They do, not just diabetes prevention.
Absolutely. Taking care of your health is an investment that pays off in countless ways. So let's take a moment to recap what we've learned so far about diabetes.
Sure, we've covered the three main types: type 1, type 2, and gestational diabetes. We've talked about the key symptoms to watch out for and how they can vary depending on the type.
And we delved into the risk factors associated with each type.
Yeah, emphasizing that while genetics can play a role, right, lifestyle choices can significantly influence your risk, particularly for type 2 diabetes.
And we explored those potential complications of unmanaged diabetes, ranging from cardiovascular problems to eye damage, nerve damage, kidney damage, and even a possible link to Alzheimer's disease.
A lot of things to keep in mind.
It's clear that managing blood sugar levels is absolutely vital to preventing these long-term health issues.
It really is. We then discussed the different treatment approaches available, from lifelong insulin therapy for type 1 diabetes to lifestyle modifications and medications for type 2 diabetes, right? Highlighting the incredible advancements in diabetes management technology like CGMs.
And finally, we emphasize the power of prevention when it comes to type 2 diabetes by making healthy choices like maintaining a healthy weight, eating a balanced diet, exercising regularly, and not smoking. You can significantly lower your risk. It's truly amazing how much control we actually have over our health outcomes when we have the right knowledge and tools.
That's such a powerful message, but I'm curious. What are your final thoughts on all of this? What's the one thing you want our listener to really remember from this deep dive?
Diabetes is a serious condition affecting millions of people worldwide. But the key message I want to leave you with is that knowledge is power.
I love that.
Understanding the different types, recognizing symptoms early, and making informed lifestyle choices can have a profound impact on your health outcomes. Don't just assume it's something that happens to other people, right? Take the time to learn about your own individual risk factors and be proactive about your health.
I couldn't agree more. It's about empowering yourself with knowledge and taking ownership of your health and well-being.
Knowledge is power.
It is, especially when it comes to our health, for sure. And you know, this deep dive has really opened my eyes to the complexity of diabetes. It's not just about high blood sugar. It's about this intricate interplay between genes, lifestyle, and those potential long-term complications.
Exactly. And there's still so much we're learning about this condition. The research is constantly evolving and there's always new information emerging, which is why it's so important to stay curious and keep learning.
Absolutely. I encourage you to explore reputable sources like the American Diabetes Association or the Centers for Disease Control and Prevention for the latest guidelines and information.
Okay.
And don't hesitate to talk to your doctor if you have any concerns or questions about your own risk factors.
Well said. I think this deep dive has given you a fantastic foundation for understanding diabetes, its implications, and most importantly, what you can do to take control of your health.
I hope so. Remember, it's never too early to start making healthy choices. Even small changes can make a big difference in the long run.
That's a perfect note to end on. Thanks for joining us on this journey into the world of diabetes.
My pleasure. We hope you found it informative and empowering.
It was a pleasure diving in with you. Until next time, stay curious and keep learning.